Леся Литвинчук, Григорій Костюк Institute of Psychology of the National Academy of Educational Sciences of Ukraine. Тетяна Синіцька, State Institution Research Institute of Psychiatry of the Ministry of Health of Ukraine. Аліна Кошнірова, Григорій Костюк Institute of Psychology of the National Academy of Educational Sciences of Ukraine. Борис Якимчук, State Павло Тичина Уман State Pedagogical University. Віталій Лунов, Богомолець National Medical University. Марина Ростока, Василь Сухомлинський State Scientific and Pedagogical Library of Ukraine of the National Academy of Educational Sciences of Ukraine. Problems associated with various pathologies of cardiac activity remain one of the most common threats of human health in the 21st century. Ischemic heart disease is a serious public health problem due to its high prevalence and mortality. Somatic symptoms can be a marker for early ischemic heart disease. Poor general health and/or painful behavior associated with systemic inflammation. Thus, it can be argued that a timely and high-quality assessment of the emotional state of patients by clinical and psychological methods plays an important role, what is important for the prevention of disorders or, if detected, for psychocorrection. The purpose of our work is to determine the main negative changes in the indicators of psychological states in elderly patients with ischemic heart disease, IHD, at the stage of outpatient treatment. To determine the differences in the psycho-emotional states of patients depending on their gender in order to improve the quality of further psychotherapy, and also to help patients in awareness and, if possible, in the normalization of their psycho-emotional state. Psychological examination of 135 elderly respondents was carried out. Of these, 41 people conditionally healthy, average age 69.73 years. That is, a medical examination did not show the presence of pathologies, including ischemic heart disease. Accordingly, 94 people were diagnosed with ischemic heart disease, of which 52 women, 55.32%, and 42 men, 44.68%, aged from 65 to 75 years. The average age of the patients was 68.87 years. To ensure the completeness of the coverage of the clinical picture of the psychological state of patient with ischemic heart disease, psycho-emotional states were considered and the methods presented in Table 1 were used. Collecting data from the study, participants proved to be quite challenging. Some elderly patients refused to take part in the study, which required an individual approach to many of them. It was explained to older people that in addition to being able to improve their own condition, their participation can serve to improve the quality of care for others. Another problem was that many had their own subjective opinion about their health, psycho-emotional state, and the need for its correction, which significantly complicated the possibility of an objective assessment. The third complicating factor was that elderly patients missed or even denied symptoms of anxiety and depression. But such symptoms could be identified verbally, and at the level of empathy, patients lowered their voice, showed depressed mood, and reluctance to make contact in some issues. The results of the analysis showed that there are a number of significant differences between the different groups related to both the health status of the respondents and their gender. Negative changes in the psychological states of elderly patients with ischemic heart disease at the stage of outpatient treatment were found according to the following indicators. Alexithymia, significantly higher than similar indicators in healthy people and in men. Depression, significantly higher than similar indicators for the control group of conditionally healthy elderly people, but lower than in men, patients of the experimental group. Anxiety. This component significantly exceeds the same indicator in elderly men from the experimental group. Neuroticity, significantly higher than in healthy people and than in men. Reduced sociability, lower in healthy people and lower than in men. Low openness, both in comparison with the men and with the control group. High emotional lability, in comparison with both EHC and KG. For all the defined methods, a set of classes was held with the elderly, the main goal of which was to rethink the attitude to their life strategies, to identify and understand their own emotional states. All participants were provided with anonymity and comfortable conditions for conducting the survey. Upon completion, a second survey was held. The resting results showed that as a result of target exposure, there were certain changes in the values of indicators of the psychological characteristics of elderly patients with ischemic heart disease, as well as the fact that between different groups there are a number of significant differences associated with both the health status of the respondents and their gender. Statistical evaluation was carried out to determine the real changes. Table 2. According to the results of the study, it was determined that negative trends in changes in the psychological states of elderly patients with ischemic heart disease at the stage of outpatient treatment include such indicators as alexithymia, depression, anxiety, neuroticism, decreased sociability, low openness, and high emotional ability. The use of a complex of psychoprophylaxis measures has shown that the psycho-emotional state of elderly patients can be significantly improved in a fairly short time. Thus, the results of resting showed a positive effect of the conducted exercises on the psycho-emotional state of patients. Some indicators, alexithymia, sociability, were not significantly influenced in our study. That is, there is a need for further research and development of methods of psychological assistance for elderly patients with ischemic heart disease, which would take into account the gender and age characteristics of patients. Thank you very much for your attention. If you have any questions, you are welcome to send them on this email address. Thank you.